Congratulations, you are pregnant. Pregnancy can be a really exciting period, but at the same time, terrifying. With every cramp, every symptom, or even the lack of symptoms, could get your mind racing and wondering if everything is okay with your baby. That is why today I'm going to share 15 clear signs that your pregnancy is progressing well from the first trimester. And even better, I'm going to give you a practical tip on what you can do about each one of the signs in order to ease your worry and feel more confident. And if you stay to the end, I'm going to share one powerful brain boosting hack for your baby's brain development that you can start right away. Hello everyone, welcome back to Good Life Medics on YouTube. Here we'll talk about pregnancy, fertility education, and all things women's wellness. If you're new here and you haven't subscribed, please hit that subscribe button. Equally turn on the bell so that you don't miss what is coming. Let's get started. Number one, no symptoms. This might surprise you, but having no major symptoms at all in your first trimester can still mean that everything is going perfectly fine. Not every woman experiences all the other classical signs of pregnancy, which I'm still going to be mentioning here for today. In fact, some women go through the early weeks with almost no noticeable symptoms at all and still have a healthy baby. What matters isn't whether you feel pregnant, but that your pregnancy is progressing fine inside of the uterus. And that is where your regular checkups, ultrasound, and prenatal blood works come in. They give reassurance beyond symptoms. So if you're one of those lucky women with almost no symptoms at all, do not panic. It doesn't mean anything is wrong. It simply means your body is adjusting differently. And yes, you can still have a healthy pregnancy and a healthy baby. Number two, morning sickness. This is very common during pregnancy. In fact, up to 80% of women report nausea and vomiting during pregnancy. Why this feeling is not fun at all? It is a good sign that your pregnancy hormones, that is the progesterone, the estrogen, and the HCG, are right where they should be. But the good news is that all these symptoms tends to disappear completely after the first 12 weeks. But there are situations where this nausea and vomiting could be so severe, causing vomiting several times a day. In that case, it is called hyperemesis gravidarum. You might need hospital treatment if that is the case. I'll be throwing a little more light on this hyperemesis gravidarum towards the ending of this video. But in the meantime, stay hydrated. Sip dilute ginger tea. Eat meals frequently a day, but in very small portions at a time. And equally ask your doctor if you can include vitamin B6 as part of your prenatal supplements, as studies have shown that vitamin B6 helps to ease symptoms of morning sickness. Number three, now let's talk about mood swings. All those wide emotional roller coaster that no one signs up for. But pregnancy insists that you must ride anyways. One minute you're angry that your fries weren't salted enough or that your sandwiches didn't have enough cheese. The other moment you're crying and shouting at your husband for breathing out so loudly. Oh my God. I remember one mom telling me that during her first trimester, she hated her husband for no reason at all. And the poor guy didn't know what he had done wrong. But guess what? The moment she snapped out of that mood, she was all cries and apologies. Like, honey, I'm sorry, it wasn't me, it was the progesterone. And yes, she was right. Progesterones and estrogen are rising like crazy during their first trimester, and that explains why your mood is always swinging like a pendulum bulb during this period. So if you feel like an angel one minute and the next minute you feel so terrible, you're not alone. It is actually your hormones at work, working so hard to support your pregnancy. One helpful tip for you: anytime you catch yourself in the middle of a swing, just take a pause, take a deep breath, and please remind your loved ones that it is not you, that is the pregnancy. That way that can safely survive the trimester with you. Number four, increased vaginal discharge. Now, let's be real for a second. No one loves to talk about this one, but increased vaginal discharge, let me know if you can relate to this. Just type present. Increased vaginal discharge is very common. It is normal and equally a good sign. Your body is producing more discharge because the rising estrogen level is boosting blood supply to the pelvic area, and that the cervix is trying to produce extra mucus in order to keep infections away. Just see it as your body's natural cleaning method. It is not fun, but trust me, it can be effective. So if you're noticing more discharge, do not panic. It simply means your estrogen levels are rising and they are trying to make sure that they keep the area clean and safe for your baby. And tip for you is use breathable cotton underwears. Use panty liner as well if need be. And please do not overwash, don't doubt. Remember, yeast infection can be common during pregnancy. So do not do anything that will mess up with the natural pH balance of that area. Watch this video to learn how to stop yeast infection. And number 5, constipation. I don't even know how to explain this one because the struggle is real. Constipation can really hit hard during the first trimester, and that is because of the rising progesterone level. It slows down virtually so many processes in your body, including your digestive system. Some moms joke that they now spend so much time in the toilet during their first trimester, not because they are going, but because they are waiting to go. So please, the tip you can do to always ease yourself is stay hydrated, load up on fiber, make sure you're taking fiber rich foods and fruits like oranges. Stay active. Some little exercises like walking can even keep things going. Number 6, lucid dreams. According to a definition, it says lucid dream is a dream in which the dreamer is aware they are dreaming and can even control the contents of that dream. Pregnancy dreams are next level. One mom even told me that she now dreams in HD. That is because your progesterone levels are trying to alter your sleep cycle, making dreams to be so vivid and even memorable. You tend to remember them very well when you wake up from sleep. Just say, I am here. If you can relate to this, you don't need to say much. One mom joked and told me that she dreamt she gave birth to her baby with full set of teeth. That is how real the dream felt for her. It is very common to dream dreams while you are pregnant. But one tip for you, do not overthink the dream. They do not predict the future. It's just a mix of your hormones, your imagination, and you can't wait to see your baby. You're dreaming of a lot of things. And if you feel so overwhelmed, you feel so terrible about it, please pray and that will help to clear your mind. Just pray about it. Okay, so those were majorly real science, but on a lighter note. Let's now get into more practical science and what you can do about each one of them. So that brings me to number 7, mild cramping. Some women experience mild cramping that seem to feel like period cramps just a little bit, or just seem like stretching sensation. This is normal and means that your uterus is expanding, trying to make room for your growing baby. But please report this if the pain is sharp or stabbing, or if it is in any way connected with any form of bleeding or spotting. Please call your healthcare provider immediately. Number 8, food aversions and craving. One mom joked that she couldn't stand the smell of coffee anymore, and this surprised her because she used to take 2 cups a day. And likewise myself, I love porridge breadfruit a lot, but once I'm pregnant, I can't even stand the smell. This is just your body's natural way of staring you off foods that might not necessarily serve you. So please swap cravings for healthier alternatives. Personally, I like to snack on tiger nuts a lot. At least they taste great and they do not contain unwanted calories. Number 9, light spotting can be normal, especially in the first few weeks. This is called implantation bleeding. But any form of bright red bleeding, with or without sharp pain, is a medical emergency. You're not supposed to be having bleeding when you're pregnant. So, the absence of any heavy bleeding is a reassurance that your pregnancy is going fine. Number 10, do you now run to the bathroom more often than you used to? This is normal. That is because of your hormones are rising, making more blood to be supplied to the kidney. Also, your uterus is growing and is adding some form of pressure on top of your bladder. So, this is normal. Fatigue and tiredness. I've seen so many moms fall asleep in the waiting room. That is because your body is building organs as well as the placenta, and that is why you feel exhausted. So please take short naps when you can, eat iron rich foods, take little mild exercises like walking. They have a way of boosting your energy levels naturally. But please avoid energy drinks. They are a no-no in pregnancy. Watch out that video to know why I explained the I no no for you. Tender and swollen breast. One mom to be told me that even hugging her partner has become painful because her breasts are so sore. That is because your rising estrogen and progesterone hormones are preparing your breast for milk production and breastfeeding. And that explains why your breasts seem fuller and even more sensitive to touch. What you can do is get yourself a good, soft, and supportive bra to wear even at night. That way, you can gain some comfort. You will even notice that the vein on your breast has even become more noticeable. They are all good signs that your pregnancy is progressing very fine. Number 12, stronger hairs and nails. You might notice during pregnancy that your hair might seem fuller and your nails longer. This is one of the nicest perks of pregnancy. So enjoy it. It's a good sign that your pregnancy is progressing very well. Number 13, healthy weight gain or loss. It is normal to gain a little weight when you're pregnant or to even lose a little weight, assuming your nausea was so severe. A patient of mine panicked that she lost 2 pounds, but her doctor reassured her that it was perfectly fine. So focus on balanced nutrition and not just the number on the scale. Let me give you a tip your doctor might not tell you. Once you get to 28 weeks, please start cutting off impulsive eating and cravings. That is because this is when your baby starts adding weight. I'm sure you don't want your baby to be so overweight. This tip is especially beneficial for mothers who would want to push. Okay, so healthy weight gain is normal, but please cut down on cravings and eat balanced meals when it is necessary. Number 14, increase basal body temperature. It is normal to feel a little warmer when you're pregnant. It is a good sign that the pregnancy is progressing fine. And finally, number 15, when your prenatal checks seems very good. This is the strongest assurance you will get that your pregnancy is progressing well. If your doctor says your ultrasound, your vitals, and your prenatal blood works are fine, then they are fine. So tip for you is never miss any prenatal appointment. If you made it up to this point, congratulations. You're about to learn something that is going to differentiate you from people that didn't get up to this point. So if you want to boost your baby's brain development from the very first start, then include omega-3 rich foods in your diet. Omega-3 fatty acid has been proven to support brain and eye development of your baby during pregnancy. So foods such as salmon, fish, walnut, and chia seed contains omega-3 fatty acid, DHA, which is literally the building block of your baby's brain and eye development. Also, invest in high quality prenatal supplements, and my top choice is Evergreen Natal Care with omega-3. It is designed specifically for moms to be, and many women who take it say they feel so good on it and that they usually do not feel the pregnancy discomfort any longer. And of course, you need to speak with your healthcare provider before starting any supplements. But when it comes to my top choice, then Evergreen Natal Care with omega-3 is my top choice. I'll find a link, a way of putting the affiliate link in the description so you can pick it up from there, assuming you want to. Conclude, pregnancy can seem like a mix of excitement and constant worry. But like you've seen today, some of these signs are normal. And remember, every pregnancy is unique. Do not compare your pregnancy with your previous pregnancy or your friend's pregnancy. And one of the smartest things you can do for your little one is by investing in a high quality prenatal that contains omega-3. Please, if you found this video helpful, give it a thumbs up, subscribe to join this family. Equally stay informed and take care of your little one, and I will see you in my next video. Thank you for watching.